All right, welcome. Thank you for joining us tonight on our last Women's Health Talk for the month of May. All month, we've been talking about all things women's health related, from proper nutrition, eliminating toxins. We talked about rest and stress management and exercise, strength training. We talked about emotional wellness and the importance of a proper rest and a good night's sleep, how all that stuff affects our overall wellness. And tonight we are talking about massage therapy and the benefits of massage therapy when it comes to self-care. So super excited to have you guys joining us tonight. And we have Jessica, who is going to lead the interview, and then Eduardo, who is our licensed massage therapist. It's going to help us get answers to our questions when it comes to massage therapy. Jessica is a really good friend of mine. She is a business partner with me, and we are both in the process of becoming certified breakthrough coaches. It's a very exciting time for both of us. So we're happy to have you here, and I'm going to go ahead and just turn things over to Jessica right now. Are you ready?
All right, I'm all ready. Hello, everyone. Good evening. We are so blessed today to be on with Eduardo. He is my personal massage therapist, so I absolutely cannot say enough about him. I want to give everyone a little bit of a background before we get started on Ed. So Ed has his bachelor's in science and health administration. He graduated from the Arizona School of Massage Therapy in 2014. He's been a therapist for going on 3 years now and feels that he has finally found his calling. This is what he really loves, guys, and you can tell. He chose to become a massage therapist because he loves helping get people back into optimal health. He has many different modalities under his belt, from Swedish, sports, deep tissue, and cranial massage. And some of the stuff that he likes to do, hiking and dance. He wants to make a positive impact on everyone's life and wellness, and he makes it a point to listen and focus on his clients, and I can absolutely attest to that, guys. So without further ado, I introduce you guys to Eduardo Baca. We're going to start off with a question right out the gate, because I think it's something that is a misnomer for massage in general. So I think people probably associate massage therapy with something that's luxurious, going to the spa. Ed, is massage therapy just for luxury?
Oh no. How you doing? Well, a lot of people go ahead and get that misinterpretation of massage therapy being just a luxury, being able to be given to people who only have a higher status. Not true. Massage therapy has been around for many, many years. From what I can think of, it's been around since before 2000 BC. So it's been a long time that massage therapy has happened. And yeah, in those times, the royalty, the kings, and everyone always had people to go ahead and give them massages and stuff like that. Nowadays, massage therapy, I wouldn't say is a luxury. Yeah, it's good to go ahead and get, pampered every so often because you want to feel good. But another thing is that massage therapy is also meant to improve an individual's mental and physical health by manipulating tissues to go ahead and help the body be back where it's supposed to be.
Thank you. So can you tell us what some of the benefits are of massage, the health benefits?
There are many benefits for massage. A lot of research has gone into being seen. Mayo Clinic actually considers massage therapy to be an alternative medicine in regards to reducing stress, anxiety. There's also, ability to reduce pain. A lot of people come to get massages and they're always saying, "Oh, I'm hurting here, I'm hurting there." But the majority part of it is coming in and, you know, helping the body go back into its natural state of helping itself heal. And with massage therapy, we're manipulating the tissues to be able to have the body help itself to get to that point.
Very good. How often should we be getting massage?
That question is pretty, you know, roundabout. There's people that you can go ahead and say get a massage every week. There's other people that are getting massage every 2 weeks. There's people that are getting massage once a month. The way I determine it when I'm working on clients is when they come in to see me for the first time, I'm literally working on them and basically figuring out what the body's telling me. And as I'm working on the clients, the muscle tissue speaks to me. I know that sounds weird, but we go ahead and get that presence of, okay, I have to be working here. I need to work here a little bit longer. And when it comes to that point, towards the end of the massage, I start telling the clients, okay, well, we have issues here, we have issues there. We need to go ahead and address them a little bit more. So I would recommend for you to come, if you can, once a week, because we need to get you worked on a little bit more to be able to get your body in that process of being able to heal itself. Sometimes I go ahead and tell people, come in twice a month, you know, every other week. That's the main thing that I have a lot of my clients right now. A lot of my clients that I see, they come every 2 weeks to see me, just because they're in that process where their body is already getting to the point of accepting it and being able to heal itself. And then once you get to that point where you understand that the body is healing, then we can go ahead and say, okay, now you can come once a month. But I would say when you first come in, you're going to probably be told to come every week, every 2 weeks. And a lot of people are like, will be like, well, I don't know if I can afford that because it's expensive to get massages every week. Well, the whole thing of it is, do you want yourself to feel better sooner? Or do you want to go ahead and prolong it for a long time and just, you know, you're going to go ahead and get the benefits coming once a week or once a month. But we want to go ahead and get it to the point where you start it and then you gradually go down to once a month. If you are at that point where you've come in to go ahead and get worked on, because I'm stressing at work, I have so many things going on in life, my shoulders are up to my ears, I'm, you know, I can't walk, I can't lay down and stuff. That's a point of, you know, yeah, you need to be seen twice or once a week and then twice a week. But it just depends on how the client perceives the process of healing. And a lot of times it comes into, I'm going to say it, the cost. Because a lot of people deter themselves from being able to come in to go ahead and get appointments for a massage because, oh, it costs too much. You know, I can't afford to, you know, better myself because of the cost. But there's ways to figure that portion out too.
Yeah, I would love to speak to that a little bit more too, and I will after the next question. So maybe you could speak to what are the different types of massage, and are there certain ones for certain ailments?
Different types of massage. The one that a lot of people are very, very familiar with is the Swedish massage. Swedish massage is basically going in and not using too much pressure. It's going in and kneading and, you know, working the body, but you're not, it's more the process of the pampering massage, where you're going in and getting a nice massage to relax, just to go ahead and be there to pamper yourself and get feeling better. That's a Swedish massage. Trigger point massage, I kind of incorporate it with deep tissue. Trigger point is when you have areas of concern when, for instance, the therapist is working on you and then they find like a ball, okay? It's a ball that's in your back, or it's a ball somewhere within your body. And what we do in there is we just go in there and start manipulating it certain ways to be able to release. Because what that is, it's basically a lot of tissue that has gotten together, which is fascial tissue that's come together, and it has bound itself together in a knot because of repetitive motion. Okay, so for instance, if you're doing this all day, all day for the last year, you're going to have some tension in your arm, in the back shoulder. And when we find those areas, we go in there and tend to go ahead and sit there for a couple of seconds just on it, pushing pressure down onto it, maneuvering it, kneading it to be able to release. Because what trigger point is we're trying to go ahead and release the big old tension that you're having there, because that little ball that you have in your back, and you're saying, oh, it hurts, it's hurting my shoulder right here. Well, you know what? When we're working on it, you might get a residual effect that, oh, wait, I just felt my leg release. Like, I didn't know I was having pain in my leg from that area. So the whole body's connected, and when you have those knots in locations, we try to go ahead and manipulate to release, to be able to extend the fascial tissue to be able to have the body, back in relaxation mode. I do also do hot stone massage, but that's at work because I can't be walking around with, everywhere with hot stones. Well, in Arizona right now, who knows? I just sit them in the car. Maybe we can use them, right? And then I'm looking into taking courses to be able to do, I was going to say the hot stone massage. What that does, it actually helps incorporate getting the heat into the muscle to help the muscle relax. So when we're working, we can actually work deeper without the client even knowing that we're going a lot deeper, because the muscle tissue has already kind of loosened up because of the heat. And that works a lot when people are like totally tight on their back. It's like you're like working on them and you do, and it's like, oh man, you got a rock back. We're going to go ahead and get some warmth in there to help loosen it up so I can get into the muscle and work the muscle out. And like I said, I'm looking into taking some classes of something that I'm kind of hesitant on, and that's for moms to be. It's a prenatal massage. Every pregnant lady needs a massage, and there's different techniques and different ways of giving a massage to pregnant women. So, because there's certain points that when you're working, you don't want to get those points, because you can go ahead and have the client go into labor, and you need to learn those areas of not working, so you won't accidentally send them to go have their baby too early. and basically that's where I'm at right now. I am also just recently started incorporating essential oils into my massages, which is basically a aromatherapy technique. And what those essential oils do is they go ahead and help relieve stress. They go ahead and help balance the body. There's also for immunity and inflammation. So there's just different oils that we can use to go ahead and help certain things in regards to all that. And those are a couple of massages and techniques that I use. There's a lot more. I mean, I have a list like this big, but those are the ones that I pretty much incorporate into all of my massages. I incorporate a little bit of all those, except for prenatal, into all of the massages, because there's not one technique that I use just to do one thing, because the body tells you so many different things when you're working on it. It's like, oh, stay here. I need you to work this out a little bit more. But yeah.
Awesome. So I want to talk about a few things that I've experienced, and I know that you guys want to hear from the professional, so I'll try to keep it brief. So the first thing I just wanted to say was that I've had a couple of different massages over the course of the last few years, and the first one that I had, stemming back maybe like 5 years ago, there was no use of essential oils at all, and it was at a large chain, and I had someone just come in. They didn't ask me much about, you know, what was going on, just kind of got started, and then released me with no real plan of care. And then I'd also gone in and seen a massage therapist there at their spa that they worked in, and there were some mystery oils with God knows what purity, potency, therapeutic grade, I don't know. Judging by the smell, they were probably more inexpensive oils. They used 1 or 2 on me, and I didn't feel like it was different. And then we had Ed start coming out to our home every other week to start doing in-home massage. I want to speak to the cost a little bit, because I have to say that what I was spending on doctor's visits and physical therapy worked well for me, but if I had gone in for any type of like injections, or I even had a doctor recommend surgery, and I mean, for some people maybe that's the case, but he wanted to do tennis elbow surgery on me, and so this was all from very repetitive motion that I was experiencing in my 9-to-5 place of employment. Then I found Ed, and he's a miracle worker. So I have to say that him being able to bring my body back into homeostasis to a place where I was not in pain was the biggest blessing and worth every single penny. So I highly recommend anyone who's dealing with any type of chronic pain issues, please know that you are worth it, and that high quality therapeutic massage is absolutely worth the money. I also have high stress, high demand between the various different jobs that I do throughout the day. And so the last thing that I just want to speak to here is actually using the Aroma Touch technique brought to the most relaxed I've ever been in my entire life, guys, my whole life. So besides when I'm sleeping, it was incredible. We're going to be posting some stuff on the Facebook page coming up, and you're going to see more about what is this Aroma Touch technique. And you guys are definitely going to want to reach out to Ed to get on the schedule so you guys can experience this amazing calming effect with decrease in inflammation like crazy, really fast, really quick. Had no idea how important the order of the oils and what oils to use. I didn't know how important that stuff was. So big deal, guys, on that. So I just wanted to touch base on that really quick so you guys knew what it was. Also, just gonna get into the next question here, Ed. So how do you know, and I kind of touched on this a little bit right now, how do you know if you're getting a high quality massage, and what should we avoid?
Getting a high quality massage, knowing that you're getting a high quality massage, starts with the first communication, first contact of the therapist, being they call you, contact them on the phone, to go ahead and say, "Oh, I got a recommendation from you. You know, can you go ahead and come into my place and give me a massage?" It's okay. So if you have somebody say, "Okay, no problem. What time do you want me to go?" "Okay, can you be here?" "Yeah, I'll be there." What I tend to do is when people call me and ask me if they can come and if I can go get a massage to them, I'm gonna say, "Okay, that's fine." I'm like, "Okay, so where are your concerns? You know, what areas of concern?" So I can go ahead and be prepared when I go to say, "Okay, this is what I need to go ahead and take with me." Because some people come in, they just take their stuff and, "Hey, nice to meet you. What did I set up? Go in, blah, blah, blah. Okay, massage. Okay, thank you very much. Bye." No. Also, another thing is when they come to you and talk to you, you always want to have a massage therapist ask you questions in regards to your health. Okay? Because it is very important for the massage therapist to do that, because we have licenses that we maintain. And if we just come in and go ahead and do a regular massage and, okay, we're done, bye, and something happened because we didn't communicate with you in regards to, are there any medical conditions I need to worry about? Are you taking any pain medications that will counteract the pressure that I'm going to be giving you? Do you have any injuries that I need to be worried about? And there's people that will tell you, no, I don't have any injuries, I don't have anything to worry about, blah, blah, blah. And that's fine. But sometimes there's that thing in the back of the head where they've done a long time ago. Like there's people that are going to forget what they've had within their lifetime. I worked on people where they go ahead and say, oh yeah, by the way, I've had a knee replacement. Oh, I had open heart surgery such and such time ago. I'm like, okay, how long ago was that? There's a duration of time where you want to make sure that they've passed before you go ahead and say, okay, you don't need doctor's excuse in regards to that. A lot of times when people come in and they go ahead and say, oh, I just recently had surgery. Okay, how long ago was that? Oh, about 2 months ago. Okay, right now I don't think I can go ahead and do that, give you a massage, or we can give you a massage, but we'll go ahead and just not work anything in that area that you had the surgery done, because I need to know that you are cleared to go ahead and get the massage. So that's one thing that you know, if you have a therapist that is concerned with your health and regards to being able to tell you, you know what, let's go ahead and cancel this appointment so you can go ahead and get the information that I need, because I don't want to hurt or do anything to go ahead and damage the area of concern. And a lot of times people will be okay with that. But you will eventually have people like, oh, I still want a massage. Well, there will be people that will go ahead and give you a massage without any of that consideration or the concern. Another thing to know that you're getting a high quality massage is during the massage, the therapist is communicating with you in regards to how's the pressure. Do you need more pressure, less pressure? Let me know at any time if it's too much pressure. Okay, you always want to communicate with the client, because a lot of people are like, oh, it has to hurt to go ahead and feel good. It needs to be painful to go ahead and get all this junk out. It doesn't have to be painful. There are ways to go ahead and manipulate the tissue without causing pain or, you know, damaging it. Another thing too is when the massage is done, you go ahead and say, you know, we give the clients homework. Okay, so I recommend for you to go ahead and be seen twice a week. I'm going to give you some homework to go ahead and do. These are some stretches I'm going to have you do. Go ahead and do those. Hold the stretches for 30 seconds each stretch. Do them about 3 to 4 times a day. And next time I see you, we'll go ahead and see how you're doing, how you're feeling. Because I want you to go ahead and give me feedback on how you're feeling in regards to, okay, are we doing the correct thing? And then, you know, when you come back, you follow through. And you go ahead and give that communication to the therapist. Oh, you know what? Last time when you did this, it was awesome. I felt good. I was good for like the whole week and a half. I just recently started getting a little bit of pain, but I knew you were going to come in and see me in 2 days, so I'm here now. So, you know, just having the communication and getting the information from the therapist, and you guys just basically, you know, keeping in communication in regards to what's happening with the body.
Awesome. Are there any side effects that we might experience post-massage, and how can we avoid them?
Side effects post-massage, temporary pain, swelling. You might get some bruising. There might be some sensitivity to the lotions or to the oils. But in regards to that, avoiding it, it's kind of hard to say avoid because it's going to happen. A lot of times, what I tell clients to do is try to go ahead and drink enough water before they come and see me. Yes, and then once I tell them, at the end of the procedure, at the end of the session, I'll tell them, okay, you need to drink plenty of water today because we did work a lot. And what the water does, it's going to go ahead and help flush out all the toxins, which, is all that metabolic waste that we're pushing out of the body to be able to leave.
All right. Is there anything we should or shouldn't do before massage?
What you should do before massage is if you're like outside working and you come and stuff like that, try to shower before the massage, because sometimes when you come in and you're dirty and we're doing the massage on you, we're moving all that dirt and stuff onto your body, which it's inserting toxins into the body. So we want to be able to be a little bit more clean in regards to that portion. Drink water. Don't drink alcohol before your appointments, before your sessions. A lot of people, we're going to go ahead and do a girls' day where we're going to go ahead and go have mimosas, and then we're going to come and do a massage and stuff like that. It's kind of a bad thing to do that because you're drinking alcohol, and then when you come and get a massage, we're moving toxins within the body. So you're actually giving yourself a double whammy on regards to getting tipsy. Another thing is it's kind of a thing where we don't like to be called masseuse, because back in the day, and it still can be interpreted that way, where masseuse is something other than a massage therapist, where they go ahead and say masseuse is like the red light district.
Okay.
We are massage therapists. We go ahead and work on people to go ahead and help, get them in homeostasis and get them out of pain. So yeah, that's another thing where that. And also, like I said, no alcohol, no drugs. That's why I go ahead and ask people, do you have any medication that you have been taking that will go ahead and counteract the pressure that I'm putting on you? Because a lot of times when you're taking pain medication, that's altering your brain and the system, and pain medication is actually taking the pain away. So when you're going in there and working on them, and you're saying, how's the pressure? Oh, you can go deeper, you can go deeper, you can go deeper. Well, I'm halfway through the table and you're still saying go deeper. There's a red flag there, because I'm like, okay, something's going on here where you're not feeling the obviously pressure that I'm doing. And I'm a pretty big guy. I'm not no dainty person that's like, oh, okay, whatever. I go in there and I get in there. And when I have people telling me, oh, it's still not deep enough, that's where I'm like, what's going on here? Why isn't this? Because, like I said, that will go ahead and turn off the signal of I'm getting too much pain, because that's what the drugs do. Drugs are horrible. Yuck, yuck.
That's what we're trying to avoid by getting our bodies back healthy again using alternative medicine. So, all right. So we've already kind of asked this question. We have the question here, what are some of the services that you provide? And maybe if you've already answered this question and don't have much else to provide, we also can talk a little bit about getting in touch with you. Where are you currently doing massage? How do we find you? So.
Well, yeah, I pretty much said a couple of them. There's also like the foot reflexology that I do. Another one is basically it's shiatsu. And what shiatsu is, it's a technique. It's of manual pressure in certain energy areas, pathways called meridians, to go ahead and help with the getting the client back into homeostatic. Shiatsu can be done fully clothed because all you're doing is literally finding the locations and just pressing them, and you're following the meridian lines where to go ahead and get everything back into the that's regular normal place. I also do cranial. Cranial is another one that is you can do fully clothed. Cranial is more like energy work, where you're dealing with the cerebral spinal fluid, trying to get it back into the motion of going to where it's supposed to be. Because throughout the day, we're all just all over the place. And I will let you know that the cranial sessions can be very, very moving. All you're doing is holding certain spots in the body, and you're not massaging, you're not doing anything. All you're doing is just holding these areas and doing a little bit of a movement, very slowly movement, in regards to filling the cerebral spinal fluid and making it go in unison. And what tends to happen with that is sometimes it opens up memories from way past. And you can go ahead and get people, when they're getting cranial session, they just start bawling, crying, because they put something in the back of their mind where they don't want anything to do with it. And because of that, because we're putting the body back in balance, they just go ahead and start crying, bawling and stuff like that. Some people will also get very angry, like they want to, get up and punch somebody because something in the past has been in their system, in their body, and it's coming out and it's trying to release. And those are very, very, very motivational movements. I will let you know that I had a cranial session done on me a long time ago, and I was one of those that just tears just started coming out my eyes. Not crying, just laying there, and the tears were coming out. And then when I finished, when the session was finished, my body just started trembling, and like literally trembling for about 10 minutes, just because it's getting the whole body back in its homeostatic state. So that's an empowering massage.
So I think I want to try one of those, and I'll have to let everyone know how it goes. That's intense. I just want to see.
Yeah.
Hey, how do we get in touch with you?
Well, through the Facebook, Empower, Elevate.
Hey, Empower.
Yeah, there we go. I'm on that page. Or you can go ahead and find me on Facebook. Also, my Facebook, I have a new one that's out. That's just my initial E, Baca, LMT. And that's where you can go ahead and find me on Facebook too. We can go ahead, I can give you my phone number in regards to people if they want to call me or text me. Phone number is area code 623-414-9031. If you call me, please leave a message, because a lot of times I'm in session, so I won't answer the calls. Or if you want, you can go ahead and text me the information, and I can go ahead and get back to you through text too.
Thank you. So we went over a lot today. It's been so wonderful. I'm just wondering, in summary, if we were going to start somewhere, if you wanted us to remember 3 things from today, what would they be?
3 things. One would be get at least 1 massage a month to go ahead and help your body get back into its homeostatic state, because that's the first step to do. Okay, if you've never had a massage before, that's the first thing. Get a massage so you can go ahead and see what it's all about. Okay. Another thing is, when you finish your massage, go ahead and follow all the instructions that are given to you. when you're done, because that in turn will help you get yourself back better. A lot of people are like, oh, you healed me, you're hurt, you went ahead and healed me and you helped me and stuff like that. I'm not healing you. I'm just helping your body get to its portion of fixing itself, because our bodies are meant to fix itself. And the drug administration goes ahead and gives us pills to go ahead and take to cover or mask what we're feeling. And last, drink plenty of water.
Thank you, Ed, so much for your time. Yep, your obligatory medal.
Yes. Can I hop in really quick? Do you mind?
Yeah.
Okay, so I just had something come up for me while you guys were talking, and I was thinking back when I had one of my very first massages after years of struggling with widespread, debilitating pain. And my massage was not pleasant, to say the least. It was very painful, but absolutely necessary. And I had a couple with a massage therapist, and then followed up with a different one. And I can tell you that the second massage therapist that I went to it spent time explaining to me how important my breathing was throughout the process. And I really wanted to see, maybe, Eduardo, what you thought about that, because for me, that made a huge difference. The pressure was about the same. The technique was about the same. But me knowing how to breathe through it helped me immensely. And so just for anybody that maybe hesitates, that deals with chronic widespread pain and thinks, I can't handle a massage, it's too painful. Can you talk a little bit, Eduardo, about the importance of breathing?
Yeah, definitely. It is very important to breathe while you're getting a massage, because when you are getting a massage, the therapist is actually going in there and giving pressure down to, the muscle tissue. And the muscle tissue is basically doing this when we're on there. We're trying to go ahead and get it to expand and relax. And we go ahead and have you breathe, because when you hold your breath, because a lot of people do it, and I have to go ahead and remind people, okay, your job is to just keep breathing through this, okay? Deep breath in, and as I go in, when they're letting it out, it actually relaxes the body to be able to get in there. Because when we're massaging, we're not supposed to force ourselves to get in there and push the muscles to. That's how you can cause injury to the client, is when you're going in there and forcing it to be able to manipulate the tissue. No, you want the tissue to go ahead and relax itself to be able to allow you to do the work. So the breathing portion of it is very important, because if you hold your breath, you're holding the muscle tissue and you're holding tension up. And when you're doing that, you're not going to get a good, effective massage, because when you release, everything releases and you're able to, let the work and allow it to be done correctly.
Yeah, it definitely made a huge difference for me. And that massage therapist was also using essential oils. And doTERRA's essential oils. I feel like that made just the breathing and then inhaling the aroma of the essential oils helped relax at a cellular level. And that reduced that discomfort that I had been experiencing before. And I went from dreading massages to just being excited about the next session. So that definitely made a huge difference for me. I just thought I'd pop in and add that. Sorry to cut you off, Jess.
No, it's all good. We were all actually done, so we can probably wrap up for the recording for today.
All right, that sounds good. So if you are available tomorrow night, I do want to invite you and remind you that Jess and I are going to hop on for a live Q&A all month. We've been talking about a ton of stuff when it comes to how we can support our bodies in natural ways and using essential oils. So Jessica and I are going to share what our daily routine looks like. What does our protocol look like? And then we're going to open things up in a chat where you guys can post your questions and we will answer them. So we do ask that you be compliant as you're asking those questions, but join us so that we can help you. Maybe you've got some hesitation, some doubt, you know, whatever it is, come bring your questions and we'd love to help support you and put your mind at ease.
If anyone has any questions for tomorrow night's session and you are feeling a little bit camera shy, please feel free to post the question underneath the Facebook post for tomorrow. And if we see it ahead of time, I can go ahead and grab people's questions. You can even probably text them to Chris and I. Chris, I hope you don't mind me.
Yeah, no, that's totally good. Yeah, we just want to make sure that we are supporting you guys. We know there's a lot of people that are already using essential oils and have questions. We know that there are also a lot of people who are thinking about hopping in and, you know, maybe using essential oils as natural solutions. And we don't want you to have anything that's holding you back, especially because we've got such an awesome promotion right now. You know, you guys can, if you're new, you can get the $50 worth of essential oils for free. So we'll talk a little bit more about that before that chance to take advantage of that expires. So hopefully we'll see you all tonight, and we want to thank you for your time. Thank you, Ed, so much for sharing with us tonight.
No problem. Thank you guys very much. Have a wonderful evening.
Thank you.